and welcome to Health Talk here on AATV Live. My name is Ogaga Ikama, and I'm your host. Health Talk is your number one health educating program where you get to learn on issues concerning your health. If you are yet to subscribe to this channel, please do that, and thank you very much. Also do well to share this video because it will be very beneficial to whosoever comes across it. Alright, so today I've got on the show a registered nurse and midwife from the Asaba Specialist Hospital, Asaba Delta State, and the person of Nurse Praise Izu. Hello, Nurse Izu. How are you doing?
Hello, I'm good.
Welcome.
Thank you.
I like your color is just, there's something.
It's poppy.
Yes, right. So today we will be looking at vaginal delivery versus Caesarean section, which some people call CS or C-section. So now, start by telling us what vaginal delivery is.
Okay, so thank you once more. When we were growing up as children, we used to see women who were pregnant and we were wondering, how did the baby come out from these women? We'll see their stomach and we'll say, the baby's in their stomach, how did the baby come? We're always wondering about that. So the fact is that the baby is not actually in the stomach, like I say, the baby is in the uterus, probably called the womb.
Okay.
So there is a gate, let me say, as an opening, a gate that separates the womb from the vagina.
Okay.
So this gate is called the cervix. So during pregnancy, the cervix is closed. So during the 9 months of pregnancy, the cervix is closed. But when labor begins, labor is the contraction of the womb and the changes in the cervix. So when labor begins, the cervix begins to open.
All right.
So it's fully dilated. Then the baby passes through the cervix, passes from the cervix through the vagina and comes outside the world. So that's what we call vaginal delivery.
Okay. So now, just for the sake of, because he took us back to
childhood.
Yes, childhood and all of that, and honestly, I was one of those persons that actually wondered. Like I can recall when my mom was pregnant for my younger sister, which I'm older than with over 5 years, and so I was kind of.
How did you come out?
Yeah, I'm like looking at it, and sometimes you know how parents can be like, come and put your ear, come and feel it. The baby is moving and it was all I'm like, so where with this child, this so-called orgy thing, where would it come out from? And now you've made that statement. So someone that's probably still a child and is wondering like, okay, maybe they already have an understanding of what the vagina is, and it's one of the places it's where they pass out urine from. Yeah. So and I'm asking for that child now, will the baby come out from where they pass out urine from as well? Do you get it?
Yeah, okay. So for the female genital part, where urine is being passed, it's not the same way it's not the same place called the vagina. We have somewhere in the vulva area, or you say the perineal area of the woman, that's called the urethral opening. Okay. So it's just like a tiny hole before you get to the vagina. The vagina is a much larger hole than the urethral opening. So urethral opening is where urine comes out from. The vaginal opening is where the baby comes out from, and the woman's menstrual cycle flow. That's the period comes out from as well. So it's a different opening entirely. Okay,
that makes total sense to that child out there. Really? Okay, so now you've told us, made us understand what vaginal delivery is when the baby comes out through the vagina. Yeah. So are there different types of vaginal delivery?
Yeah, so we have 3 different types of vaginal delivery. We have the spontaneous vaginal delivery, like when I explained. There is no medical assistance. The baby just comes through from like I said, when the gate, which is the cervix, opens, the baby comes through the cervix, through the vagina, and comes out to the world without any external or medical assistance. It's called spontaneous vaginal delivery. Then we have number 2, assisted vaginal delivery. This is where we make use of forceps or vacuum extractor. So for example, if a woman is in labor and she gets to a certain stage and she cannot push again, then they use the use of forceps to help assist her bring the baby to life. Then we also have induced labor. So induced labor is a type of vaginal delivery whereby the doctor or the midwife gives the mother and an injection and medication to help induce labor. So there are different conditions though that will make them induce labor. So for example, if the baby is post-date, we say post-date meaning that the baby has passed 9 months and want to bring the baby out, they will induce labor. So like, then also if the mother has any medical condition like preeclampsia that starts hypertension
During pregnancy.
We have, that's another topic. We have hypertension during pregnancy, we have preeclampsia, hypertension, and proteinuria, but let's just leave that. So if a woman has a condition called preeclampsia, doctor and the midwife can also decide to induce labor. So induction of labor is based on the findings of the midwife and the kind of condition, rather the obstetrician that makes that call whether to induce labor or not. That's the third type of vaginal delivery.
Okay, so now from explaining what vaginal delivery is to the types of vaginal deliveries, you talked about, especially when you're talking about this induced labor, you mentioned something earlier when you were talking about what vaginal delivery is. You said that you talked about the cervix and is the gate that opens up for the baby to come through. So, and now you also talk about induced labor, inducing labor so that the cervix can open. So if labor is not induced, how does the cervix have the knowledge, the intelligence in quotes, to know when to open up for the baby to come? Okay,
so that's why I said that during the normal course of life is that during the 9 months the cervix is closed. But after the 9 months there's what we call labor. That is the movement, the contraction.
So it's just part of the natural process.
Course of life. Yes. So in a situation where labor has not occurred, for example, when the baby is post-date, meaning that baby has stayed more than 9 months and labor has not still occurred. So to assist that woman, they now induce the labor, give her something that will now help open the cervix and cause contraction.
Okay. Now, while we still dwell on vaginal delivery, are there any associated risks, side effects, as it were, that comes with vaginal delivery?
Okay, yes. So vaginal delivery, like we all know, is the most natural form of delivery. But it doesn't mean that it doesn't have its own complications, or rather its own risks. So what are the downsides of vaginal delivery? So we have, I think the major complication we have with vaginal delivery, or the major issue that accompanies vaginal delivery, is hemorrhage. Hemorrhage, which is bleeding.
Okay.
Yes, bleeding after delivery. So there are different causes of this hemorrhage. So, and this hemorrhage is one of the leading cause of maternal mortality, meaning that it's the leading cause of deaths in women during deliveries. So one of the causes of this hemorrhage is tone. So whereby the uterus after delivery refuses to contract, to go back to contract and go back to its position, it could cause bleeding. Then another is tissue. So when we deliver the baby, we don't just deliver the baby, we deliver the baby and deliver the placenta.
Okay.
The placenta is what connects the baby to the mother. That's where you get nutrients and all of that. So if after delivery you deliver the baby and the placenta is retained, or any part of the placenta is retained, then it could also lead to hemorrhage. And
when you say retained, inside the
yes. So you have brought the baby out and the placenta is still inside the woman. So it could cause hemorrhage, which I said again is the major cause of maternal mortality. Then another cause of this hemorrhage is tear. So the tear could be natural or artificial. So if a mother is in labor and we see that the baby is bigger than the vaginal cavity, or the vaginal cavity is not big enough to accommodate the baby to pass, we can give the artificial tear, which is called episiotomy. So it just cuts open to accommodate the baby to pass through and help the woman deliver. So that one is an artificial one. It's called episiotomy. But we also have natural tears that occur during delivery that could cause this hemorrhage. One of those tears is the perineal tear, which is the tear in the perineal part of the woman, which is the vulva, the part that we can see. We can also have the vaginal tear, meaning that there's a tear in the walls of the vagina. The baby is too big for the wall, so during the process of delivery, baby, like the wall will definitely tear to accommodate the baby passing. Then we now have the cervical tear. So like I said, the cervix is like, in quote, is the gate between the womb, which is uterus, and the vagina. So when there's no opening, when the cervix is not open yet, and the woman pushes during labor and the cervix is not properly open, the woman pushes before the cervix properly opens, can cause cervical tear, and that could lead to hemorrhage, lead to bleeding. So that some of the risks are associated with vaginal delivery. That is why it's very important that when a woman is pregnant, she goes to a good facility. So these risks that we're saying, or these things that could arise, can easily be tackled if you are in a good, well-equipped health facility. You know how to arrest all these things and prevent damage, or any risks to you and your baby. So it's important that they go to a good health facility.
So before I move to my next question, just this follow-up question from what you said.
Okay.
You said when the placenta does not come out fully.
Yeah.
But the midwives or doctors can normally cut the placenta, right?
Okay. So what they are cutting is the umbilical cord.
What's the difference between umbilical cord and placenta?
Okay, so the umbilical cord is what connects the baby to the placenta. The placenta is what connects from the umbilical cord to the mother.
Okay, umbilical cord from the baby to the placenta.
Yeah.
Placenta from umbilical cord to the mother.
Yeah.
So you cut out the umbilical.
When you bring the baby out, you cut the umbilical cord, you clamp and you cut, say you remove the baby, then you now deliver the placenta.
What do you mean deliver the placenta?
That's like bring the placenta out now. After delivering the baby, we want the placenta to come out as well. So deliver the placenta after the baby.
So if there are complications bringing out the placenta, that's an issue too.
Yeah, so those are saying that those are...
So they can be complications. I thought placenta is just like a rope, so to say, just pull it up, right?
No, like it's adhered to the womb now. It adheres to the womb. That's why it
has
can
to be
take...
done technically.
Yeah, so we deliver little by little.
So with these, should I say reasons to avoid, this could be some reasons to avoid vaginal delivery, or if you have other medical reasons, you stay there. Then someone that's heard this and says, are there alternatives to vaginal delivery, medical alternatives?
Okay.
That it does not need to be a situation of complications. You just be like, I don't think I want to go through this vaginal delivery. For example, in a situation when you said maybe labor does not happen naturally and you want to induce a lady and she's like, must I be induced for labor? Is there an alternative to this?
Okay, so firstly, I want to do a disclaimer. The fact that we said that these are some, I don't think risks is the right word for those things I just earlier mentioned. I think, what would be the words? Like, I don't know the right word to use. But if I'm going to stick with risks, I'm saying that those things that I said, perineal tear, cervical tear, there are things that can actually be controlled. If you are, there is no one size fits all by saying that. Like, if you're in a good health facility, those things can be controlled and they can, be guided to prevent them from happening. So it doesn't mean that for every woman who will deliver, she must have a cervical tear, she must have a vaginal tear. So disclaimer. So you're not afraid of delivery. You can have a smooth delivery. I'm just saying these things happen. That's why you need a good health facility. So back to your question on the reasons for people to avoid vaginal delivery. I will not say reasons to avoid, but there are, as much as vaginal delivery is the most natural form of delivery, there are some conditions that may require the gynecologist to recommend, or the obstetrician rather, to recommend another form of delivery. So the focus for delivery for us is actually safe delivery. And what safe delivery means is baby alive and well, mother alive and well. So regardless of the type, in quotes, of delivery we have, our aim is that we have baby alive and mother alive. So if there is any condition or circumstance that we see that may hinder having that result, then they will now recommend another sort of delivery for you. So some of these conditions, this is not an exhaustive list, there are many more. What I feel I'll just mention is if the mother has multiple gestation, meaning that there are more than 2 children in the womb, So it doesn't mean that if you have twins or triplets, you can't give birth to them vaginal. But if it depends on their position and the review of the doctor. So the doctor reviews the pregnancy during ultrasound and all of that, and sees there's a need for the mother to have a cesarean section, they would say that. So multiple gestation can be one of those circumstances that can make us say, okay, you know what, for baby and mother to be alive, let's look for an alternative. Then secondly, placenta previa. I'm going back to this placenta issue.
What's that?
So placenta previa is whereby the placenta covers that cervix I'm talking about.
Oh.
So we said cervix is the gate now between the uterus and the vagina, and it has to open for the baby to come out. So if the placenta is covering that place, it can be a conjunction. You know what? This placenta has covered this place. Let's have a cesarean section. Then another is prolonged labor. So the baby has been in labor. The mother has been in labor rather for a while, and she's not progressing. They can decide to now say, okay, let's have a cesarean section. I think another is placenta abruption. So placenta abruption means that the placenta is detached from the uterus, from the mother's.
Okay.
So because of that, we're saying, because it's a risky situation, because this what is keeping the baby alive in the womb now. So if it leaves the mother's uterus, it means there's a problem. So they can say, okay, let's have a cesarean section. So there are many more, conditions that they would see to say, okay, you know what, there's to have, because I said our goal is to have safe delivery. So if any condition, any circumstance, even fetal distress, maybe they check the baby and they see that the baby is in distress, I say, okay, let's remove the baby out as soon as possible. We can, give an alternative method of delivery. So it's not set in stone. Rather, when you come for your antenatals, do your ultrasounds and all of that, they review you, the obstetrician reviews you and all of that. They now determine what procedure you are going to have.
All right.
Yeah.
All right. It's still Health Talk here on AETV Live. The conversation is on vaginal delivery versus cesarean section, and Nurse Praise Izu has been enlightening us on what vaginal delivery is all about. In the next episode, we'll consider the alternative to vaginal delivery. Please remember to subscribe and turn on notifications so you'll be notified when the next episode drops.